Hello, peer support stakeholders of Montana. My name is Thomas Richburg, and I'm the co-chair of the Behavioral Health Advisory Council, BAC, Subcommittee on Peer Support and Recovery Services. And if you're here, that probably means you're looking to take the survey we've created seeking your feedback on potential revisions to the Medicaid rules governing billing for peer support in Montana. And I want to give you some insights before you delve into the survey on the why behind it. It's all about access to care. That is our bottom line. We know that peer support is unique in its ability to reach folks when you have someone with lived experience, going through them day to day, the trials and tribulations of early recovery. It just is life-changing and potentially life-saving. And so just know that why we want you to take this survey is we want your feedback on whether the potential changes to the Medicaid rules we discuss in the survey would increase access to care to peer support. That's our bottom line. And I also want to give some brief background on Medicaid and peer support. So peer support became a profession certified through the Montana Board of Behavioral Health in 2017 through legislation. And then in 2019, again, through legislation, it was made a Medicaid billable service. So 5 years have passed since then. And we now have been able to collect data on utilization. And I think, when you get 5 years out, you take a look and see, okay, do we need to make some changes to the regulatory environment, to increase the access to care? And that's what this survey is about. So if we look over the last year, there were 23,000 hours of peer support billed in the entire state of Montana to Medicaid. And I don't want to make it seem like Medicaid is the only source of funding for peer support, nor should it be, but it is a foundational part of the funding mix for peer support. And so you have 23,000 hours billed, and there are 237 active certified behavioral health peer support specialists. So there's less than 100 hours per active peer support specialist billed each year. And I think that told us on the subcommittee that, there could be some room for improvement in ways that we could look to open up access to care. And with that, I want to go through some questions in the survey that have been somewhat confusing to people. I want to start with number 10, and that talks about a peer support provider type, a new provider type. And what we're trying to get at here is expanding out the number of providers that are able to bill and opening it up to some smaller businesses, some smaller organizations. So currently, there's a list of 6 that's in the survey, provider types, federally qualified health centers, mental health centers being 2 of them, that are able to bill Medicaid for peer support. And what these have in common is they're relatively large institutions. And so they're able to cover some overhead costs, say, that they have to have that provider type, have a medical doctor, right, that is overseeing care. That smaller organizations simply aren't going to be able to cover. For example, like recovery homes or recovery community organizations, which are peer-led groups, or a small group clinic. Say you have a licensed addiction counselor, one licensed addiction counselor, one licensed clinical professional counselor, and a peer. They're just not going to be able to cover the same level of overhead costs that a large organization, with dozens or hundreds of employees, is able to cover. And so this new peer support provider type, we're hoping, right, that it will maintain all the guardrails that, you're going to require clinical supervision, and there has to be, a lot of safeguards in place to ensure that it's quality peer support, that there's integrity, that there's ethics, but that it lowers the threshold, the cost to become this new peer support provider type, to open it up to some smaller businesses and smaller organizations to be able to bill Medicaid. The second one I want to talk about is question 11, and that discusses severe disabling mental illness. That is a term of art, and it in essence means that a person to have an SDMI, either currently or in the last 12 months, it has to impact their life so they need long-term care or would not be able to live in the community setting, right? So it's a much higher threshold than a mental illness. So what we're saying is, well, if you lowered that from requiring an SDMI diagnosis to simply a diagnosis of a mental illness, do you think that's going to increase the access to peer support if you're able to bill Medicaid for someone that has a mental illness, not that higher level of an SDMI? And then finally, I want to talk about question 12, which is the crisis criterion as a medical necessity to build peer support. So when you think of a crisis, it by definition, right, is something that's unexpected. And so no one prior to a crisis is going to say, oh, I better go get a substance use disorder or a mental health diagnosis, and then I can have my crisis, right? They need help now. And so what that criterion would recognize is that when people need help, they don't necessarily get a diagnosis first. And so you could have a peer respond to a crisis, be able to bill Medicaid for responding to that crisis, and then they would open a 14-day window when they'd be able to bill Medicaid until that person, can be given a diagnosis, get treated. And so it would be much more likely that peers would be involved in crisis care, since there's a funding stream that would cover the costs of them responding to those crises. So those are ones that have given folks trouble, and I hope that clarified things a little bit. But the bottom line is we want to hear from you as stakeholders around peer support in Montana to let us know, do you think that these proposed revisions are going to have a meaningful impact on crisis care, or sorry, on peer support in Montana? And I just want to thank you truly, all on behalf of everyone on the subcommittee, for the work you do day in, day out, help and support people that are struggling with behavioral health issues. So with that, I hope you take the time, complete the survey, and I can't thank you enough for your feedback.